The surgical outcomes in Africa were poorly documented, and we think there's a big burden of disease, and if we want to make a difference to public health in Africa, we need to understand what's happening. ASOS is the African Surgical Outcomes Study, and it was conducted by a group of clinician investigators across Africa. So we are a group of about 1,000 investigators based in 25 countries. In Africa, we know 95% of patients don't have safe and affordable surgery. We know that patients are twice as likely to die. So there is an urgency that our group feels this needs to be dealt with. Now, normal clinical trials take years, and so we've taken the philosophy that we're going to do this in a much bigger, faster scale. Between 15 and 20% of all the patients will be into this potentially higher than average risk group. So instead of focusing all attention on all the patients, what we want to say is, let's focus on 1 in 5 patients in the post-op period.
In those hospitals, people are trying to help. They're trying to treat those complications and they're failing. Now, if you catch the complication here versus catching the complication here, the amount of effort, resources you have to throw at the problem to solve it is much greater.
What we want to do is see that if you flag patients who you believe are at increased risk of complications, you give the healthcare team the heads up that these patients are at risk, and you ask them just to provide increased surveillance for those patients that we might improve outcomes. The limited data set that we had for ASOS, it's powerful enough to build a simple risk model to identify or flag patients at risk. So we have 4 interventions in ASOS-2 for increased post-operative surveillance. The first is we could put the patient in a high care ward, such as this. This is a post-op high care ward. The second thing is we could increase the frequency of the nursing observations. Thirdly, we could put the patient in a bed closer to the nurse's station so that the nurses can always see the patient. And finally, if all those are difficult, we could ask a family member to sit with the patient and flag us when they're concerned. With WhatsApp and Breakout is very exciting because what it does is it removes this need for communication just through emails and a website. It means now we can create groups and we can communicate and receive data from clinician investigators through WhatsApp and integrate it into our REDCap database. It allows the clinicians to provide data through a different source. I believe it will increase the compliance we have in the data retrieval, in that we can use it to prompt it to investigators about incomplete CRFs, etc. So personally, I believe it's a very powerful way to move, especially for research in Africa, and it's exciting to be involved in a project with Breakout like this.
People in Africa are talking on WhatsApp. We use WhatsApp groups in our work to discuss interesting cases, to learn things, to coordinate care, to collect data. And it just seemed to make sense to try and leverage that power, and Breakout made it happen.